Hello and welcome back to the sixth module, the second unit and the first classroom. Remember in the previous unit, we talked about various types of health financing, tax-based, health insurance, out-of-pocket direct fees, etc. Here we are going to talk specifically on tax-based health financing, what are its advantages, what are its disadvantages, and we will take some examples from different countries to make our point. So what is tax-based financing? It is basically a type of financing where the source of revenue for the health services comes from taxes collected by the government. Normally, there are two types of taxes we talk about. One is the direct taxes, in which the person who is liable to pay and the person who actually bears the burden of the tax is the same. For example, income tax. You and me have the burden of paying our income tax and we have to pay directly to the income tax department. So these are called direct taxes. For example, like I said, income tax, corporate tax also. The companies are supposed to pay every month or every quarter their profits to the corporate tax department. Similarly, wealth tax. Somebody's got a lot of wealth, then a portion of that is collected by the tax department directly. So these are examples of direct tax. Advantage of this is that it is very equitable because those who have pay more compared to those who do not have. On the other hand, you have indirect tax where the burden of paying tax is on person A, but the liability of paying is on person B. For example, sales tax. The burden is payment is by the customer. When you and I buy, say, a mobile phone, we have to pay the sales tax to the shopkeeper. But then the liability of paying to the government is the shopkeepers, not ours. So there is a difference between the person who is paying and the person who submits it to the government. So some examples of indirect tax are sales tax, VAT, value-added taxes, excise taxes, registration of property, etc. The advantage of this is that it is a very wide-based taxation. So practically everybody in our country, from the poorest beggar who has to buy a matchbox to light his stove, to the richest billionaire in India, all pay taxes, indirect taxes. The difference is that there is no variation depending on the income. So whether Mukesh Ambani or whether the beggar on the street buys a matchbox, they pay the same sales tax. So that is the problem. So it is not very equitable compared to direct taxes. The main advantages of taxation is that it is very easy to collect because there's already an existing taxation system. So people, when they get their salary, already the tax is collected at the source. Or if you are buying some computer, then immediately the sales tax is collected and transferred to the government treasury. So the collection of taxes is much easier compared to other forms of financing. Pooling is also very good because everybody contributes whatever, either little amount or large amount, they contribute towards this revenue of taxes. The third advantage is that it is equitable, especially when we are collecting more direct taxes compared to indirect taxes. Then those who have pay according to their capacity, while those who do not have pay much less, and so there's an equal distribution of wealth for health services. However, there are some disadvantages. For example, in low-income countries, usually the tax base is very limited. For example, most low-income countries, only their source of revenue from taxation is only about 10 to 20% of the GDP. Most middle-income countries have about 20 to 30%, whereas high-income countries spend about 30 to 40, 45, 50% depending upon the country. So obviously, the richer the country, the more taxes are collected, and because more taxes are collected, there's more money for health services. So inherently, poorer countries have less money for of less collection of taxes, and so less money for health services. The second disadvantage is, even if the money is collected, a lot depends on the political will of the government. In many low-income countries, governments choose to spend more money on arms and ammunitions rather than on health and education. And because these are very powerful ministries, naturally there's more allocation to defense rather than on the health sector. So there again, there is a problem. For example, in India, only 3 to 4% of our entire budget goes on health sector, whereas the defense gets about 10% of the budget. So you can see where the priority of our government is. The third disadvantage is that because it is coming through a government system, there are usual inefficiencies of the public sector as well as leakages like corruption, etc. So these are some of the disadvantages of having a purely tax-based system. Many countries in the world are financed heavily by taxes. One very good example of this is the United Kingdom. After the Second World War, the then Prime Minister decided to adopt the Beveridge Committee report, wherein they said that the health and health services are a right of the people, and the government will ensure this right by financing it through tax revenue. So in UK, 40% of the GDP comes from taxes, both direct as well as indirect. And then 15% of that goes to the health sector. Compared to India, where only 17% of GDP is from taxes and only 3 to 4% goes to health sector. So once again, I repeat, 40% of GDP is coming from taxes, and of that 15% goes into health sector. And the money is used to provide the health services through the National Health Service, both at the hospital level as well as the primary level. So it's a very comprehensive package of services which is provided to the average British citizen. One main advantage of this is that everybody in UK gets free health services at the point of care. They do not have to pay any money, or maybe a very small token co-payment system. So people can access healthcare without worrying about any financial repercussions. Second advantage of the tax-based financing, especially in UK, is that it is very equitable, because the poorest British citizen as well as the Queen of England all contribute towards this kitty, which then provides health services through the National Health Services. However, like I said, every advantage also has a disadvantage. Because the demand is much more than the supply, there are usually long waiting queues for various services. For example, if you need a hip replacement, you have to wait for 1 to 1.5 years before you get your surgery done. Or if you need a bypass surgery and it's not emergency, then you may have to wait for at least 3 to 6 months. So that is the disadvantage of having a limited tax-based financing. Yet another example is Sweden, which is a very heavily taxed country. 58% of the GDP comes from tax revenue, and 10 to 11% of that is spent on health services. The government is the financer as well as the provider of the services and provides a comprehensive package of services from womb to tomb. Only dental services are exempt, where people may have to pay some co-payment for the dental services. Rest everything is free, because there's a huge inflow from the taxes, and then the government also allocates a substantial amount for health services. A recent example is Brazil. Remember, Brazil is one of the BRIC countries, so we are kind of a peer to India. Brazil collects about 37% of its GDP from taxes compared to our 17%, and allocates about 8% of that for health services. And again, a very comprehensive set of services are available to the patients who need it. Not just the patients, even preventive and promotive services are through this tax-based mechanism of financing. Closer home, we have an excellent example of Sri Lanka, a small island to the south of India. This is a island which has been facing civil strife for the past 30 years, but still they have managed to put aside substantial amount of money on healthcare, and today they are one of the low-income countries which is nearly reaching universal health coverage. Primary care and secondary care is totally free and provided to all the people through government providers. Only tertiary care they purchase from the private sector, which means that about 90 to 99% of people can go to a government sector and get free health care without having to pay at the time of use. Again, because the Sri Lankan government has allocated a lot of money for health services compared to many other low-income countries. So to summarize, tax-based financing is one form of financing where the main source of revenue comes from taxes. It is very effective if the tax base in the country is large, if the money is allocated for health services in a effective manner, and the money is used efficiently. There are both advantages and disadvantages of tax-based financing. Main advantage is that it is easy to collect, there is a lot of pooling, and it is equitable. The main disadvantage is that always the funds are limited, and so there is a problem. There's never enough to meet all the resources of all the people. Thank you very much, and see you soon in the next classroom.